tuning back into Megan's treatment. I really appreciate all the likes and all the views I got on the last video. I'll continue this series with some thoughts on what I'm trying to accomplish here. Initially, when starting the session, Megan told me she was having some hip pain on her left side, and I assessed through visual assessment that her left hip was laterally rotated out. My question to you, the client, to you, the therapist watching this video, is if you had a certain spot that your client or you as a client pointed to your therapist, and your therapist worked on a different area, would you be annoyed with that, or would you allow it? Therapist, if your client told you that they're having pain in a certain area, but you knew that was coming from a different area, would you still work on the area that your client wanted you to work on, or would you take it into your own hands and work on the area that you think needs work? In this situation, I believe that Megan's psoas is a little too tight, so I know I have to go in from the anterior aspect of her body, but at the same time I still want to get some suppleness in the lower back, in the QL, lower back erectors, upper glutes area as well. And this might confuse a lot of people, but as therapists, we need to understand on how to treat you properly. If you're pointing to some area that is not in the realm of where your pain is or coming from, then as therapists, we gotta take it into our own hands and figure it out. Heading back into Megan treatment, she was also complaining about some shoulder pain, which I could tell was in the rotator cuffs through my assessment. And what I'm doing here is doing some pin and strip. I'm pinning down the rotator cuffs with my thumb, and with the other arm, I'm moving her arm, elevating it over her head, trying to get that muscle to relax. Our next step to follow is some more soft tissue work. We're going to be doing gua sha and a cupping therapy sequence that you guys do not want to miss. So please like, share, and sub to these videos. I'll be putting out more content, guys. I really appreciate it. You guys all have a great day.